My name is Mthethwa. I'm a gynecologist and obstetrician in private practice. I've been in private practice for 14 years now, and I'm very passionate about women's health, and I am very keen or believer of holistic care, not just treating patients and women as the condition, as a diagnosis. There's always more to the label, as it were, of a diagnosis to actually get women to really have holistic wellness. The emphasis, from when girls are young, they should be healthy, eat well. We teach them, eat your veggies, be active, do sports. And then they grow up, and puberty. Some girls do struggle through it, some sail through it, but there's a lot of looking after and helping along. And as women get into their early reproductive age, in their 20s, 30s, the shift of promoting care and more of preventative care almost like falls off the grid, and suddenly the focus becomes, when you want to be pregnant, this is what you must do, prepare, be healthy, and after babies it's like it all vanishes. Then women must find their way, which is a big failure in my opinion, because the stages of women, of life, of change, that's when they actually come in, when nobody's really looking after them. So self-care really should be hand in hand with when we're teaching young girls before puberty even, to be active, sports, eat well. Everybody's drumming up, have your veggies, everybody tells and knows and advises what to do. And then there's a big void post-reproductive, having babies, because everybody's paying attention, everybody's helping, research, there's so much stuff and information and support, as it were, readily available. And that's the life in women, in my opinion, in my experience. Lots of challenges come, be it from physical, illness, conditions, life, social, family, mental, and to add on top of that, the stage of perimenopause, transition to menopause, and menopause. And it's not just a midlife crisis and stage waiting to happen, but
that's what the
majority of women are not prepared for it. Menopause, average age, for the average woman population, healthy, is 51, 50, 51, 52, in that range. But the transition into that is a longer period for most women, which usually happens for, a lot of studies say 47 up until that 50, 51, but in my experience, you see it from mid-40s. So women from about 45, they start going to what looks like a transition. Things are changing. But menopause, you'll hear people talk about early menopause, Scientifically, menopause before the age of 40 is regarded as abnormal, what we call premature ovarian insufficiency. That's an abnormal failing of the functioning of the ovary under the age of 40.
Okay.
So that's a different group of women who need to be dealt with slightly different, because it's abnormally early by scientific definition. But women who will then have menopause before that average age of, say, 50, 51 can be regarded as having early menopause. But the transition is usually mid-40s, about 45, 47, And it can take a couple of years before someone is actually in early menopause and then late menopause, which is like the established menopause. So the transition can take a while, can take 3 years, 6 years in some people. So the changes would be different. It's not one symptom, one sign that will define. So it's a cluster of things that it needs to be looked at and say, you look like you're in transition. You're not yet menopausal.
Mm-hmm.
You're probably in transition, which is the perimenopause. And then when you're menopausal, there's early menopause and there's late menopause. There seems to be a shift in absolute focus in looking at the hormone level, hormone number, because I see a lot of women who get very frustrated, who would come with symptoms. So the diagnosis is not based on just a number, because you can find a woman who is, say, 45, coming in with symptoms which sound and feel like menopause, and yet they're still having their menstrual bleeds in a change pattern, but they have other symptoms, and they say it's my hormones, do levels, and the levels come back normal. That doesn't mean the woman does not have a problem. And that's where, the problem comes, because you will find one clinician can look at it and say, oh, you're not menopausal, Well, the levels don't say it, but my body and what I'm experiencing is saying something else. Hence the definition of the transition, the perimenopause. A lot of women in those 45 to before 51, they're actually not menopausal yet, they're in transition.
Mm-hmm.
And the important thing is a woman needs to be assessed properly. An explanation needs to be given to where this is where you are, this is what's happening, and this are the options you can look into. But there needs to be an understanding. Maybe let me go back and say, just like puberty, this is a statement I tell all my patients and all the ladies I work with. Just like puberty, menopause is not a disease. It's not something wrong happening to you. It's a stage of life that's bound to happen to women at some stage. Like puberty, you don't wish it away, you don't want to cancel everything, because the girl must develop and those things must happen. And it's a fact that some women really struggle, so they need help.
Mm-hmm.
But for the woman to get proper help, there needs to be proper assessment of where are you in the stage, and there's different ways. The important thing clinicians do is there has to be a proper detailed history. So there has to be proper conversation with the woman.
Yeah.
And based on symptoms, which for women who haven't had a hysterectomy, haven't had procedures or anything like endometrial ablation to stop menstruation, the history involves menstruation, your pattern, what's happening. A lot can come from that to say what's happening to you. Usually in the last year, the last 6 months, as I say, the transition can be anything between 3 to 6 years in some women. And what are you feeling? Are you having what's called hot flushes or flashes, night sweats, mood change, a bit of anxiety or depression?
And some of the ones that
brain
sit out,
function.
and some of the ones that sit out of that norm might be urinary tract infections.
Yes.
And different things like that
Yes.
women would never associate
Yes.
that being related to a perimenopausal state.
Yes. With that comes, normal sexual function, normal what you call libido, sexual desire, which speaks to exactly what you say, what you call uterovaginal changes.
Mm-hmm.
A lot of women can be sometimes treated for this so-called recurrent thrush, and they
Mm-hmm.
actually have a vaginal issue, which is hormonal, with the lack of estrogen or changes in estrogen, which gives what looks like UTI symptoms, which are not always UTI symptoms, and it's not always thrush, and mental functioning, cognitive function, the so-called foggy brain. So there's a whole list. So there has to be time spent with proper conversation to say, this is what you're having. The symptoms, a combination this is what it means, including periods and all those symptoms. And then the discussion be, do you have medical conditions? Like I said to you, a lot of things happen to women. They've been pregnant, they've had, in the 40s, some women are already at risk for certain comorbidities, for other unrelated, from a gynae point of view, medical conditions, which can contribute to some of the symptoms, you know, so that mustn't fall out. So there's always needs to be an exclusion. You very well may be in transition, perimenopausal, but you could find other conditions are adding, and there needs to be proper ruling out, assessment and diagnosis and proper treatment of those things. Not everything labeled as menopause, but some things will actually worsen conditions. Some women are already at risk before their 40s of having certain medical conditions, which will then show up in their 40s and just complicate the management.
Okay.